In this crisis, we must work together. And just like all of you are working together to stay safer at home, DHS has been working through our State Emergency Operations Center strike teams to respond to our immediate needs and begin to prepare us for the next phase of this response. A lot of very smart people have been putting their heads together to provide us with the data we've needed to make policy decisions. Like the governor said, our data and our models tell us that the policies are working to flatten the curve. When we hear flatten the curve, we think graphs and lines and color coding and numbers. But we need to remember that the curves on those graphs represent people, and the flat line indicates our hospital capacity. If the people curve isn't below the hospital line, those who need hospital care won't get it. Flattening the curve means we can treat all those who need hospitalization, and it means saving lives. As part of this effort, we've increased the contact tracing capacity of local health departments to follow up with people who have tested positive for COVID-19, making it possible to better track the virus and check in with others who have been potentially exposed. Policies like physical distancing and safer at home have made it possible for our local health departments to increase the percentage of cases they reach with contact tracing and decrease community spread. And we will need to continue to significantly expand our contact tracing capacity to effectively manage this outbreak moving forward. This is another reason that building our lab capacity is so key during this crisis, and we will continue to focus on increasing testing moving forward. In fact, we have 23 active labs running COVID-19 tests in Wisconsin today with a daily lab capacity of 3,886 tests. The more effective our safer at home and physical distancing policies are, the more effective our testing is at reaching people who need it most. And moving forward, our expanding capacity will work hand in hand with our contact tracing efforts to facilitate our ability to actively and aggressively manage this pandemic. And for those with symptoms or who have tested positive, we've opened 2 self-isolation sites and provided guidance and blueprints for local communities to do the same. These facilities will continue to be a critical asset as we further ramp up testing and contact tracing by providing places for safe isolation and quarantine to reduce community spread. While it's not enough, personal protective equipment continues to come in through the PPE donation and buyback program, and that PPE continues to be distributed to first responders. Working with the Army Corps of Engineers and local leaders, we have scouted sites to build out Wisconsin's healthcare system capacity. This will include alternative care facilities on the grounds of the Wisconsin State Fair and at the Alliant Energy Center in Madison. An alternative care site needs staff to run it, and hospitals and clinics across the state will also need more staff during a potential surge in cases. This is why we've launched the Wisconsin Emergency Assistance Volunteer Registry, as Governor Evers announced last week. If you're interested in volunteering, please visit the website weavrwi.org to learn more and to sign up. Wisconsin needs you, and we are so grateful that you will be volunteering.